Hey, what's up everybody? Welcome back to my channel. How are you today? My name is Tamisha, also known as Mrs. Coda. So today in this video, I'm going to be talking about how to document group versus concurrent therapy in your sessions. How should you write it? What should it look like? And how are you billing? All right, I'm going to jump into it right now. All right, so in today's video, I'm going to take you into a treatment note, all right? And we're going to talk about how to structure your group versus your concurrent. What is the difference between the two? So just so you know, whenever you hear concurrent therapy, what does that mean? That simply means, and side note, this is pertaining to a skilled nursing facility. That is my field of expertise, and this is tailing towards that. I cannot comment on how it may be in pediatrics clinics, but for the most part, a lot of groups are being run in the skilled nursing facility. So if you are someone that works in a pediatric clinic, I would love for you to comment on the video and let me know. Are you guys running groups? That would be really cool to find out. Anyway, back to this video. So the difference between concurrent is you have two patients that you're working with that are doing completely separate tasks. All right. So again, a concurrent is you have two patients that you are working with that are doing two separate tasks. Whereas group therapy is you have two or more patients you are working with that are doing exactly the same task. Okay, so we're going to look at how do you bill and document for group therapy. If you're not familiar with concurrent therapy, definitely go ahead and take a look at the video right here where I talk about concurrent. Okay, here we go. I'm going to take you through this example here. All right, so to keep it simple, let's say you did an upper body dressing group with 4 individuals, and they each have 30 minutes for their group and 15 minutes individual under your billing schedule. Okay. All right, so when you go under your CPT code for your group, just note that I believe it's 90852. This is within the skilled nursing facility. This is your billing code for group. But definitely, I'm pretty sure this is what it is off the top of my mind. But, you know, if it's not, definitely just check into that. But I'm pretty sure this is the billing code for groups within a skilled nursing facility. All right, so when you go in to do your billing, you're going to put 30 minutes in the section for group, and then let's say if you did one-on-one, maybe let's say exercise with that patient, you put 15 minutes with let's say person A, and then maybe with person B, you would go ahead and you would say, okay, I did 30 minutes with my group for person B, but then we didn't do exercise for our individual session. We did let's say a balance activity. So then you would put 15 minutes under that. Okay, so that's kind of how you would structure it pertaining to your billing when you have these patients. Let's say you have these two patients in your group that you also have individual, whereas the other two patients that you have in your group is only with you for the group. Okay, so again, let me rephrase that. You have 4 people in your group. 2 of them you are seeing for 30 minutes, and you have them for 15 minutes individual. The other 2, you just have them for group, which is 30 minutes. So for the people that you only have for group, you're going to put in 30 minutes on their billing under 90852 code. The other 2 people that you have for group as well as 15 minutes individual, you're going to bill it as 30 minutes on the group, 15 minutes under patient A that I mentioned, you did exercise, you put that under that, and then patient B, you did a balance activity, you put the 50 minutes under that. Okay, so I hope that that was pretty clear. All right, so quick little scenario here, and I hope this helps. So let's say patient John. All right, this is how you're going to document it. So keeping it simple, The patient participated in 30 minutes ADL, parentheses, upper body dressing. I forgot to mention that part. Let me just add that in. There we go. All right, so upper body dressing. And yeah, let me continue. Sorry, I forgot to add that part in. You could either write it like how I did, upper body dressing, or let me give you another way of writing it. You can just write it as this, okay? Both ways work just fine. And again, don't get too hung up on, how you're writing it, particularly just make sure you have the structure down. All right. So the patient participated in 30-minute ADL training group pertaining to upper body dressing session. Okay. The patient required minimum assistance plus 50% verbal cues to don shirt and supervision plus 50% verbal cues to doff due to limited range of motion of right upper extremity. The patient was instructed in compensatory technique to facilitate proper hand placement to improve independence with upper body dressing. The patient did not complain of pain during treatment session. Continued upper body dressing training is required to increase ADL independence. All right. So then you do the same thing for each patient depending on how they performed in the group. Again, the key is you are billing depending on how they perform in the group, and you also need to mention that the patient participated in the group. All right, so in your billing, you add the minutes like I mentioned before, and then in your notes, you make sure on the group that you add your note as shown above. All right, sweet, simple. Again, I'm going to mention to you guys that if you like this and you want to know more, you want me to do more of an extensive video on this, I definitely can. But also in my product that I have in my product store, which is my group intervention, this is definitely broken down so much more in detail for you. All right, so I hope that this was helpful. So I hope that this video was helpful. I have revamped my group intervention product. If you go down below in my description, you will see my group interventions. I have definitely updated that. So definitely go ahead, click on it, check it out. It gives you more detail into PDPM, and also the cool thing is I provide you with 50 different group ideas. I know, crazy, right? 50 different group ideas. I also provide you with a structured form. It's called Group Therapy for the Everyday Occupational Therapy Practitioner, and I provide you with 50 ideas, right? 50 group therapy ideas that you can implement and start right now. So I provide in-depth detail into PDPM. Everything you're going to need to know about that is in this new updated version. Also, I provide 4 structured, systematic group examples for you to follow on how to break down your groups, how to structure it. Then I also give you a printable form that you can actually use while you are running groups, and then you can create a binder and put it in there, and before you know it, you're going to have a list of different groups right there in your facility as your go-to. And also, just like what I have here in this video, I'm going to have even more of a detailed documentation example for your group. All of this is now available in my updated group therapy product, which you can find right below in the description. All right, guys, I hope you enjoyed this video. Until next time, take care. Bye-bye.